Okay, we're back from that break, and before we get another caller, if we happen to get one, I want to we have a special deal I want to do on this show. I have this picture that I've had in my collection of pictures, and I'm going to get my producer to put it up on the screen, and I want someone to call in and tell me what that is. And I want to see if you have an idea of what that is, and hopefully, don't be shy. That's the call-in number, 727-8750, and tell me what that's a picture of. And we'll leave it up there just another minute. I can tell you that that happened here locally in Pahrump. I took the picture myself, and I'm hoping that somebody who's watching the show can kind of figure out what that is and give me a call back. Okay, we'll leave it up there for just a minute, and you'll hear my voice in the background. One of the things else we wanted to talk about, I was talking earlier about oxidative stress, and one of those things that happens in our body in aging and scar tissue. People have a lot of allergies, people have a lot of COPD, and they have other problems. They do form a lot of free radicals because it's an inflammatory process. And you might benefit from some products that help to reduce those free radicals. You can go on the web and you can look at this particular product, and it might help people that have that. I know it's been very useful in multiple sclerosis and the exacerbations of that. Okay, so we have a caller who has the answer. Okay, what's your name?
Oh, this is Amy.
Amy, okay, what is that a picture of?
Oh, okay, I think what that is, you have limited area around MRI because of the strong magnetism. You try to keep certain things out of that room. Well, evidently somebody did not do a very good job keeping something out of that room, and the machine was turned on. It pulled the chair right to it.
That's very...
I hope the person wasn't in it at the time it happened.
No, I believe they were getting out of there, but that's exactly what that is. And that just shows the power of an MRI magnet, and how powerful those magnets are and what they actually do. And somebody was getting out of their wheelchair, and it pulled the magnet right up into that, so which shut the MRI down. Just to let you know that with regards to MRIs and how they work, as opposed to CAT scans, CAT scan is X-ray. And X-ray is in a tube, and basically it's what they call computed tomography. The old standard in the old days was to focus a beam of X-ray. You could call what they call a tomogram, and we used to do those. And the focus of beam, your body is this big. They can focus the beam a little bit here, 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 and here, and try and get pictures of your body at different levels. And the computer-enhanced tomography is basically they spin this X-ray around, and the computer does all of that. The problem with that is it's a lot of X-ray. One of the things they don't really tell you is that a CT scan of the chest could be the equivalent of several hundred chest X-rays. So there's a tremendous amount of X-ray in CT scanning. So for those people that want to do that all the time, I would caution you about the exposure to that amount of X-ray. With that being said, an MRI is a magnet, and what they do is they basically take a very strong magnet in different axes, meaning they'll turn them in different ways, and they align the water molecules in your body. We are basically 98% water and 2% solute, so which would be salt. So basically what it's doing is it's taking a different concentration of water molecules in different tissues and aligning the polarity of the water molecule. They're taking a water molecule and spinning it in a certain way. Water itself is a polar object, and I know you've done this experiment where you take a glass of water and you put it, ice water, and you put it on a glass table, and then you try and pick it up, and it does not want to pick up. And that is basically the polarity of water. Basically, you have an oxygen with two hydrogens on it, and the oxygen tends to pull the electrons from the hydrogen, exposing the protons. And so now you get negative on the oxygen and two positives on the hydrogen. Well, guess what? now you have another hydrogen up here, and it wants to face or come into the oxygen. So water molecules have this electromagnetic force, and that is what holds that glass on that glass top. And so it's very difficult. You have to slide it off. Well, they use that same principle to magnetize your water or align the water molecules, and they get signals based on that, and that's how they, in a computer, turn it into a picture of your body. MRIs are very useful for soft tissue and sometimes bone, and CT scan, vice versa. So if you have any metal objects in your body, obviously, and you expose them to that magnetizing force, that could be disastrous results. So now they're using more titanium and other metals that don't have magnetism involved, and therefore they're safe for MRI, but not a lot of the old stuff was. So that being said, certainly if you had your choice between an MRI, they're a little more expensive, but they're easier on your system and not exposing you to so much X-ray. But MRIs are not for every part of your body, only or certain areas. So let's talk a little bit about that water force, that polarity, and what happens in that polarity. That same force is what keeps our lungs open. Our lung lining basically is a thin layer of tissue, what they call the pleural lining, and in between that pleural lining is a very thin layer of water. And that's the only thing that holds your lung open. That way, if someone pierces your chest with any type of object, a bullet or a knife or anything like that, they actually separate. The same thing as pulling the water glass off of the table, they will drop your lung. And that's called a pneumothorax, or basically air in your lung, and air separates your lung, and basically it just collapses and you can't expand your lung. So they have to put what they call a chest tube in there and actually suction your lung back open again. So pneumothoraxes usually come from penetrating injuries to the chest. However, there are what they call spontaneous pneumothorax, where it just happens out of nowhere, where air can separate through that lining of the lung and actually close the lung. And I've seen that. Actually, we had a young gentleman come from the school in Amargosa where he was eating, I think, lunch or dinner, and all of a sudden started having chest pain and a little bit of shortness of breath, and sure enough, he had a spontaneous pneumothorax, and probably had to have a chest tube to put that back in. Sometimes they resolve on their own, sometimes they don't. So a little bit of anatomy and some pathology in that particular thing. Okay, so one of the things I've talked about on the numerous shows is I've talked about a lot of the problems with prescription drugs and addictions, and I have a few slides that I wanted to, that I don't know if I brought up, but I wanted to bring them up again. The difference between basically a drug addiction and a drug dependency, and a drug addiction is basically defined as doing something. Addiction is defined as doing something despite the negative results. So, and I think what we can see in that is that if you smoke and you know that it is a dangerous thing and your health could be affected by the smoking, or let's suppose you have COPD and you're on oxygen, and believe me, oxygen does ignite. I have pictures of patients who have burned their faces pretty substantially from smoking while on oxygen, and you think, who would do such a thing? But trust me, that's a definition of an addiction, meaning there's a negative consequence of the action and you ignore it and you continue to do that behavior. Obviously, in this particular area, you could go into one of the local grocery stores and never make it past the slot machines. That's a gambling addiction. You're going to buy groceries, but you never make it there. And another example is basically you can see lying to your healthcare provider about the last lost pain medications, driving while intoxicated. Well, you know, you've lost your judgment. You've crossed an imaginary line. You're placing yourself at risk, the innocent people at risk on the highway, and taking medications that are not prescribed, or taking medications that were prescribed to someone else. I mean, how do you know you're not going to have a reaction to it? Just because your friend hands you a pill, it's supposed to be okay. And so I don't know why people sometimes don't think those all the way through, but those are negative consequences. And obviously there's the more politically correct definition, which is using a drug in a compulsive fashion, not for its intended medical effects, but for its pleasant psychic effects. So obviously that's a no-brainer on that one. Now, dependency is something that basically is when you take a product or a prescription, you take it as prescribed. It alleviates a symptom and it makes you better as a result of it. And if you stop taking that product, the symptoms come back. And that is basically a drug dependency. So if you're taking it for pain and you become dependent on that medication, then basically what you're doing with that is you're using it in a responsible fashion, but your body needs it. So that's not addiction. Okay, that is not being addicted to a product, because you're using it in the guides of which it was given to you, and the prescription, you're not taking it on your own accord, you're not doing something with it that has deleterious effects to your body and to other potential people. So one of the things that's kind of useful with that is the elderly population today. A lot of times when you prescribe pain medication, they're not interested in that. And we'll talk a little bit more about that when we come back from this short break.